Antidepressant Optimisation Service. Depression is a common and serious mood disorder categorized by depressed mood, diminished interest or pleasure in activities, feelings of worthlessness, and suicidal ideation. According to the World Health Organization, depression is one of the leading causes of disease or injury and is predicted to be the leading cause by 2030. From data shown, the incidence of depression is increasing on a yearly basis, with 70.9 million prescriptions given out in 2018 compared to 36 million in 2008. Therefore, there is a huge need for mental health services, specifically those targeted to depression, as on average 52% of people are non-adherent, which can lead to poor control of symptoms, most notably suicidal ideation, which can lead to self-harm, suicide, and self-induced hospital stays. Eastleigh is a borough of West Hampshire with a population of 130,000 people. In Eastleigh, there is prevalence of depression of 10%, resulting in a higher than average number of self-harm related hospital stays, which studies have shown to be linked to bad adherence. Our service aims to improve the rate of adherence, improve depression management, improve symptoms, reduce self-harm related hospitalizations, and reduce the NHS burden. This will be achieved through providing a service which aims to give patients with newly prescribed antidepressants full consultations over 4 months in which pharmacists will assess suicide risk, counsel about benefits, side effects, and manage patient expectations in order to increase adherence, patient outcomes, and decrease hospital stays. The service is based on a pilot study by Adler et al., which conducted 9 consultations over 18 months and found an increase of 20% compliance and 30% compliance in difficult-to-treat subgroups. This shows that pharmacist-led intervention could support patients and improve adherence. Patients that will be eligible for the service will be patients coming to the pharmacy with a prescription. They will be over 18 years old, newly prescribed antidepressants such as citalopram, sertraline, fluoxetine, and amitriptyline, prescribed for unipolar depression and no other mental health conditions. Pharmacists delivering the service will undergo training to ensure they are competent to interact with patients with depression. They will be required to complete CPPE training module consulting with people with mental health problems, mental health and well-being, complete a mock consultation, and pass an MCQ test based on clinical knowledge of antidepressants. The wider pharmacy team will be informed about the aim of the service, and various local charities and support groups will be able to refer patients if needed. Staff will also be required to adhere to an SOP. To raise awareness for the new service available, we will ensure brochures and posters are erected within the pharmacy, inform other pharmacies of the service, and GPs about the new service. In addition, text reminders will be available for those who sign up, and at the launch of the service, the pharmacy team will take part in a mental health awareness day. In order to achieve our goals, we have created a service milestone map which provides an outline for key events in a timeline of the first 12 months of the service. This service aims to reduce the NHS costs associated with issues resulting from antidepressant non-adherence. We have estimated that the cost of the service per patient will be £30 based on the previous study by Adler, which estimated the total mean consultation time was 70 minutes, which would equate to £30 of the pharmacist's time. This is a dramatic decrease from the cost of self-harm induced hospital stay, which is £809. Our service aims to ensure that patients with depression receive exceptional support from a community-based pharmacist in order to improve their adherence of the antidepressant therapy. This will be achieved by providing information about their therapy, which enables the patient to make an informed choice. The service puts more readily accessible community pharmacists as a patient's primary contact with regard to their antidepressant treatment. We hope that the service will reduce self-harm and self-harm related hospital admissions.